The brain is the most important part of our body. It controls what we do head to toe. Mental health affects this part of our body. But why do many still choose not to acknowledge the disease for what it is? Take a look.
The reality is, when people hear the word mental health, some may think it's a weakness or it's used as a crutch, but for many,
mental health is an issue.
Samson Sharma is a social work professor at Alabama A&M and has worked closely with mental health. He says that the illness doesn't just affect one person. Genetically, it can impact an entire family, then branch into a different community, nationally, and even worldwide.
Mental health is a disease, in itself, and it needs to be treated as such.
But why isn't it?
A lack of knowledge in terms of what mental health is, what mental health involves, the effects and the impacts of mental health.
Professor Sharma said a way to bring knowledge is to teach mental health in schools and universities.
We need to have, workshops, programs in schools, high schools, colleges. Around mental health should not be limited or should not be restricted only to schools, to institutions. This knowledge should trickle down. Trickle down from the institutions all the way down to the communities, because there are people within the communities that suffer from mental health, illnesses.
He says that support groups would help bring awareness and help others that need help and resources. If you would like to educate yourself on mental health, visit our website for reliable resources.